Hello friends, can you hear me? Am I audible to you? Am I audible to you? Please let me know if I'm audible to you. Please say yes or no. I'm not able to understand what you're saying. Please reply. Thank you, Devya. Thank you very much. Okay, shall we start? Give me a second. Just give me a moment. Please excuse me for a minute. I'm so sorry. Just a second. Okay, so let's start. Sorry for the delay. I was trying to match the pictures with that of this. Okay, this is the introduction I have to give you. If you would like to take plus subscription, you can just use my referral code. I have to leave this mandatorily. So use plus session Dr. ASMYT as the referral code. And there are many free live classes going on. So tomorrow, if you would like it, we'll have one session on microbiology. Would you like it? We'll have past questions. Past previous year questions. Would you like it? Yes. Okay. So we'll have 40 to 50 real-time all India, AIMS, JIPMA, PJ Chandigarh, NEET, also FMGE, UPSC exams. We'll have mixed bag of MCQs tomorrow exactly at what time shall we have it? Shall we have it at 10 p.m.? Is 10 p.m. okay for you people? Because I have continuous classes. Is 10 p.m. okay for you? Okay. So, okay, let me apologize for this mistake. Yesterday I told you we'll have a class at 8:15, but I didn't have a class at 8:15 because I had a class before. I just now finished another class. It went on till 8:30. So that is why I reached at 8:45. Sorry for this mistake. Please forgive me. Don't be angry with me. I'm really sorry. So tomorrow we'll keep it exactly at 10 p.m. Okay. So 10 p.m. to 11 p.m. 1 hour session tomorrow. I hope you'll be coming tomorrow. And this is the referral code you can use. So let's begin. This is where you can join me on Telegram to answer a few questions. On Facebook, you can follow me here. On Instagram, you can follow me here. Let's start with the first question. Thank you, people. So let's start with the question here. Consider the following statements. Acute respiratory distress syndrome characteristically occurs in which of the following? Consider the following statements. Acute respiratory distress syndrome characteristically occurs in which of the following statements? 1. Granular septicemia. 2. Gastric aspiration. 3. Pancreatitis. 4. Severe burns. 5. Myocarditis. You don't have to use the poll. We'll use the poll from the next question. Tell me what can be the right answer here. Acute respiratory distress syndrome. Give me the answers in the comment box section. We'll see how many of you will get the right answer. Okay, Shreya Reddy says D, 1, 2, 3, 4. Yes, any other answer? Come on, people. except myocarditis, everything. Okay. So popcorn says B, gastric aspiration, 1, 3, 4, and 5. Okay, 1, 3, 4, and 5. Okay, as expected, remember, myocarditis generally does not cause respiratory distress. Myocarditis is known for causing only chest wall pain. So you can eliminate 5 out of the equation. Questions are not visible. Oh my God. Be happy. Are you able to see the question now? Be happy. Is it okay? Nice. Okay, look at this. We are focusing on myocarditis, who does not cause acute respiratory distress syndrome. Remember, whenever there is a gram-negative septicemia, there is a possibility of the infection to attack your lung as it passes through the pulmonary circulation also. Pancreatitis can happen because it is capable of making enzymes leak. Gastric aspiration is one of the most important mechanisms by which you can have ARDS. Let's look at the first question, which can be coming under poll. Botulism can have the following clinical features except. I'm so sorry, something is happening here. Come on, people. Are you able to see the poll? Okay, thank you very much. Yes, come on, answer faster. Excellent. Only 35% people got it right. Look at this question. This is the top of people. Ken Adams, Dr. Sheldon, Raj, Fatima, Sharif Ahmed, Varshini, Debayan, Twinkle, Balmurugan, and Chandrasekhar. See, the right answer is hyperpyrexia. Why? Please remember, botulism is an example of food poisoning. Shall I tell you some important features about this food poisoning? Only if you want. 5 to 6 points. Okay, listen carefully. Generally, food poisoning is supposed to be non-systemic. It should not be a part of your circulation. At the same time, it should be localized inside the GIT. It should be self-resolving. And it is not caused by the organism, but caused by the toxin. And food poisoning should be causing diarrhea and vomiting or nausea. These are the general rules of food poisoning. But botulism breaks every rule of food poisoning. It does not cause diarrhea and vomiting. It causes constipation. It is not localized. It becomes systemic. At the same time, it is not capable of being self-resolving. It is fatal. And it is not caused by exotoxin. It is caused by a neurotoxin. Did you all understand the difference here, people? The 4 important differences. Botulism is a type of food poisoning. At the same time, it is different from other food poisonings because it is not self-resolving. It can be fatal. It is not a localized attack. It is a systemic attack and the patient dies. And also, it does not cause diarrhea. It causes constipation. Every point, it is against that of any food poisoning. But remember, botulism does not cause fever or hyperpyrexia. It can cause quadriplegia, cranial nerve deficits. What is the symptom you see? You will see diplopia as a part of cranial nerve deficit. And the most important cause of death in botulism is respiratory failure. What is the cause of death in case of tetanus? What is the cause of death in case of tetanus, people? In botulism, it is respiratory failure. In tetanus, what is the cause of death? Excellent. That is also respiratory failure. Very good, Raj. It is diaphragmatic contraction. That is also respiratory failure. The difference is in tetanus, you have spastic paralysis of the skeletal muscles or the respiratory muscles. In case of botulism, you have flaccid paralysis of the muscles. That is the huge difference between that of botulism and that of your tetanus. Excellent, people. Very good. Next question. A 54-year-old man, non-smoker, presents with sudden. Oh, wait a minute. Okay, this is not a microbiology question. Let's go to this question. Consider the following statements regarding Helicobacter pylori. It's a gram-negative bacterium. It invades epithelium. It produces urease. It produces chronic gastritis. Among the following, which one is the true statement? Excellent. 82% people have got it right, and you have been very fast in your answers also. I'm so proud of you. What exactly are you supposed to make mistake in? In this question, option B would have been confusing. Option B would have been confusing. Tell me whether option B is true or false. Welcome Gaurav Chitkara and Jashwit. Gaurav Chitkara, you have come before, right, to this class? Okay, so tell me whether option B is true or false. This is the leaderboard. Tell me whether option B is true or false. False. Please remember, Helicobacter pylori is a non-invasive organism, but it depends on the toxins. It does not have invasions. Please understand, there is no invasions on the surface of Helicobacter pylori. So invasion is not seen, but it has toxins. The most important toxin can be urease. What will the urease do? Whenever there is urea present in the stomach, it will break the urea and produces an ammonia. That ammonia will react with the HCl's chloride to form NH4Cl. That becomes a salt covering on the organism, so that furthermore HCl will not be able to destroy the organism. The organism becomes safer. So toxicity is the property of Helicobacter pylori, not the invasiveness. Excellent, people. Next question. A 60-year-old patient presents with gradually increasing dysphagia to solids for 3 months with significant loss of weight. The most probable diagnosis is what? This is not a microbiology question, so I'm not putting a poll. Give me the answer in the comment box section, if you can. Most important statement is significant loss of weight. So what should it be ideally be? See, some questions can be overlapping. I generally try to extract all the questions related to infection. That is why some questions are being here out of the syllabus. So please don't be angry with me. We'll focus on the next question here. Good. Consider the following statements. Gentamicin should be added to empirical regimen for acute meningitis. It's correct, Raj. Gentamicin should be added to empirical regimen for acute meningitis for patients aged more than 55 years. Ampicillin covers Listeria monocytogenes. Which of the following given statement is true? Let's see how many of you gets the right answer. See, this question paper is almost 4 years old. So right now, if you ask me a question, the answer differs. But when the question was raised, the answer was different. Why? Let me tell you this. See, Listeria monocytogenes cannot be handled by just ampicillin. It requires both ampicillin plus gentamicin combination. But previously, ampicillin is known to cover Listeria. On that basis, option B is true. But option 1 is absolutely wrong. Can you tell me which part of option 1 is wrong? Botulism does not cause a change in your temperature, Athena. That is why we take it into consideration. Athena, botulism is not supposed to make a change. Which part of option 1 is wrong? Excellent. More than 55 years, kidney function tests will be coming down drastically. Gentamicin will not be able to push the drug out of the body. Okay, let's go for the next question. Which one of the following gases is used for sterilization of pharmaceutical products? Simple question, very simple question. Pharmaceutical products means if I expose them to heat or any other kind of temperature acting activity, they can be destroyed. Because this is a very easy question, am I audible to you? Hello? Yes. So if the connection gets cut in between, please understand it's not my fault. Something is wrong with this area. So let me know if there's something wrong. The right answer is A. Now try to go for the question. The following statements about peptic ulcer are true, except eradication of H. pylori is a part of medical management. Diurnal ulcer invariably changes into malignant. Complications are indications for surgery. Zollinger-Ellison syndrome is associated with intractable peptic ulceration. Among the following, which one is absolutely false? Without the poll, tell me what is the answer. Which one is absolutely false? Excellent. So whenever you have peptic ulceration that can lead to adhesions, there is a possibility of complications being treated. Are you finding some disturbance in this class? Are you finding some disturbance in this class? Is it getting cut? I am not okay. Let me refresh the page once. Now, is it clear? Is it clear now? Okay. So, in this question, remember one important thing. Zollinger-Ellison syndrome is associated with intractable peptic ulceration is true. What is meant by intractable? Can anybody tell me what is the meaning of the word intractable in this context? When you have gastrin producing ulcer or gastrin, not respond to medical therapy or surgical therapy is the right answer. So when you have Zollinger-Ellison syndrome, gastrinomas can be seen, because of which extraordinary amount of HCl is released. So when you put proton pump inhibitors or H2 blockers, the drugs have not been useful enough to stop them. That is why you have intractable peptic ulceration. Option D is absolutely true. S. In a patient with a lacerated injury foot who is not actively immunized against tetanus, which one of the following is indicated for tetanus prophylaxis? This is not a very old question. You could have a different answer if this question was asked 25 years back. But current, there is only one answer. Hey, crazy medical. Yes, Athena, I'll be telling you. Definitely, I'll tell you. I won't skip without telling you this, right? Is this what you have understood about me? Will I be leaving you without telling you the answer? Even if you know, if you say no, I'll be still be explaining, right? Now listen carefully. The treatment of choice can still be penicillin. Absolutely true. Because Clostridia, Treponema, and Streptococcus pyogenes, mark my words, Clostridia, Treponema pallidum, and Streptococcus pyogenes are the three organisms which are still responding to penicillin. Till date, they respond to penicillin. Now, penicillin can be given as a treatment of choice. But look at the question. They're asking you for tetanus prophylaxis. Prophylaxis means what? You are trying to make the patient a better patient. So the patient can, when he comes face to face with that infection, he should be able to recur. It means his body should be filled with immunoglobulin. Tell me, which kind of immunoglobulin is always better? Is it passive immunization or active immunization? Which is always better? Chandrasekhar, passive immunization is out of date. If you watch any 1980s movie, for example, there is a South Indian director called as Maniratnam. If any of the Maniratnam movies are seen in 1980s, if somebody is getting hurt, they'll say, please put an ATS injection. They'll put an ATS injection. That is what the word comes out of the mouth of the doctors. But now they say put a TT injection. Previously it was ATS. Now it is TT. Excellent. Good question, Radhika Chandra. Patient is having lacerated injury foot. What is needed here? The laceration should be repaired. The local area should be debrided, and he should be given proper kind of penicillin. And if you give tetanus toxoid, the immunoglobulins can be formed faster even before the toxin can be released. The only thing is proper wound care and proper kind of TT would be enough to treat the patient. Immunoglobulin is not useful right now for any kind of condition. No immunoglobulin should be added. Non-tetanus prone wound, if there is tetanus dirty, that is what I'm saying, there is laceration. The first thing is to convert the dirty into clean wound. That is what you have to do, not put the patient on extra dose of immunoglobulin, because immunoglobulin can cause anaphylaxis and you can't use the second time because of faster excretion of the product. Simple line. Tetanus immunoglobulin are hyperimmunoglobulin. They can be horse immunoglobulin. They can cause anaphylaxis. For that reason, we are not using it much. We have to go for TT. Next question. Consider the following statements. Life-threatening pneumococcal infection is a complication seen in which of the following conditions here? Idiopathic thrombocytopenic purpura, sickle cell disease, thalassemia minor, nephrotic syndrome. Now some people will be confused. Oh my God, what is happening? Remember, in case of nephrotic syndrome, there is massive proteinuria. Massive proteinuria does not mean just albumin is lost in massive amounts. It slowly starts losing globulins also. What are gamma globulins? Poll is not seen. Okay, I'll refresh it. What are gamma globulins technically? Gamma globulins are antibodies. So in nephrotic syndrome, there can be a sudden fall in the antibody concentration also. Antibodies are important for what? Their primary function is to act as opsonizing agents. When opsonization is not happening, then which kind of bacteria can become more dangerous? Capsulated bacteria. The whole concept here is Pneumococcus is a capsulated bacteria. Idiopathic thrombocytic purpura does not actually make a huge difference. But in sickle cell anemia, what happens to the spleen? Yes, I'm going to tell you that. Tell me. In sickle cell anemia, what happens to the spleen? Yes, there is autosplenectomy. In thalassemia minor also, though it is not massively symptomatic, if thalassemia minor is not treated symptomatically every single time, the destroyed RBCs can keep on clogging on the spleen. So spleen is mostly focused on dealing with the hemolysis. It will not be having enough time to deal with the infection. So in thalassemia minor, the function is occupied. The spleen's function is occupied by the RBCs. In nephrotic syndrome, there is no immunoglobulin. In sickle cell anemia, there is no spleen, because of which splenectomy can become dangerous. At that point of time, pneumococcal infection can become more deadly. The best answer is 2, 3, and 4. Did you understand this, Raj? Raj? Okay. Pseudomembranous colitis is caused by which of the following? Now, all these questions were dilemma-based questions. This question should be dead easy, right? So you should be happy. Say, don't be angry if you like the question. Don't show the love to me if you like the question. Be it a wrong question, deadly question, easy question, likable question, hateable question. All these are previous year question papers. I'm just being a moderator who's trying to bring it to you. So please don't hate the messenger. If you want to hate the message. Okay, I'm so sorry. Okay, so the right answer would be Clostridium difficile. Here also some people have made mistakes. Clostridium perfringens is not known for causing pseudomembranous colitis. It is made for causing food poisoning 30% of the time and causes gas gangrene in 70% of the time. So E. coli, no colitis. Shigella does not stay in your body and irritate you. Shigella is like a hit and run case. In the highway, a particular bike comes and hits you, or a vehicle comes and hits you and runs away, right? Shigella comes here, makes you bleed profusely, causes dysentery, it can cause shock and death, or it leaves the body. That's all. Okay, let's go for the next thing. In which of the following diseases primary skin lesions are not seen? Without the poll, give me the answer here. In which of the following skin diseases primary skin lesions are not seen? Okay, let me show you the poll itself. Go for it, people. Yes, most of you have given the right answer. In leptospirosis, we have Weil's disease, where thrombocytopenia can happen, because of which purpuric painless rashes can be seen. Yesili is known for having skin lesions. And when you think about infectious mononucleosis, though it is capable of causing mucosal lesions, it is also capable of causing primary skin rashes. The only one not known for skin rashes is hepatitis B. Let's go for the next question. Look at it. A 3-year-old child is brought for sudden inability to walk following fever of 2 weeks duration. On clinical examination, sensorium is normal. Both the lower limbs are hypotonic, with the right limb more affected. Right limb more affected than the left. Plantar reflexes equivocal, and deep tendon reflexes are not elicitable in the lower limbs on both sides. What is the most probable diagnosis? No poll, because it's not a proper microbiology question. This is just a contamination question from other subjects. This is a neurology general medicine question. I just wanted to see whether you'll be able to give an answer. Yes, remember, in the spinal cord, if you cut it midway, what do you call it as? If you cut it midway, what do you call it as? No. Hemisection. Excellent. Transection. So when you have transection, and the transection can cause transverse myelitis, the answer should be C. Why am I saying this? Because it is not on both the limbs equally. Poliomyelitis, though it is attacking only one limb most commonly, but it does not have predilection. Here, lower limbs are hypotonic, with right limb being more affected than the left. Plantar reflexes equivocal and deep reflexes are not elicible. So poliomyelitis is about a motor activity, but this one is attacking your sensation also. Sensory activity is also gone. That is why I have to focus on myelitis, which is transverse. It cannot be infective polyneuritis. If it is polyneuritis, it will attack many parts of your body, not just your lower limbs. Okay. Next question. X-ray of the skull in an infant shows periventricular calcification. Periventricular calcification. What is your answer? Periventricular calcification. Around the ventricles, calcium deposits. Now tell me, is it dystrophic calcification or metastatic calcification? Whenever there is an infection closely followed by necrosis and then followed by calcification, what is it? Dystrophic or metastatic? Excellent, people. It is dystrophic. What is the gross difference? In case of any hormonal imbalance causing hypercalcemia, because of calcium being excess, that causes calcification. What is it called as? Because of excess calcium, there is calcification. What do you call it as? Excellent, metastatic. So remember, just because it is metastatic calcification, don't assume that only in cancer you will have calcification. In cancer, you may have paraneoplastic syndrome. You will have hyperparathyroidism. There you will be having excess amount of hypercalcemia that can lead to calcification. That is what is called as metastatic. But when there is a dead tissue around which calcium deposits, it's called as dystrophic calcification, which can happen in cytomegalovirus infection. Next question. Look at this. With reference to food preservation, which of the following statements is or are correct? Yes, correct. Thank you, Dr. Sai. Pasteurization means the heating of a food product to a sufficiently high temperature to kill all the organisms present in it. B. In the case of food preservation by sterilization by heat, food high in acids are very easily sterilized as compared to those low in acid. What is the best answer here? No poll. Just give me an answer here. Some questions are not showing the poll because it will be pointless to go for the poll, because this can be very vague questions which will make you feel distorted. You may be a very good student, but because of such vagueness in the question, say I didn't frame the question, I'm just showing you that these questions can be vague. So when you have a vague question, you try to answer and get a wrong answer, you'll be disappointed. That's why I'm not putting the poll here. Yes. So most of you are saying B, 2 of you are saying C and D. Now I'll give you a homework. Do not worry about option 1. Option 1 is definitely true. Find out whether option B is true or false. That's all. I'm telling you option 1 is definitely true. So A can be an answer or C can be an answer. Now you have to tell me whether 2 is true or false. Whether 2 is true or false. In case of food preservation, sterilization by heat, just because there is acid, yeah, I understand. Just find out whether acid can be, if a food contains more acid, will it be easily sterilized or not? Just find this out. You'll be finding a lot of new information. Okay, now let's start this question. Microscope was invented by. Quick questions. Recent exam questions. I have picked questions only from 2015. Okay, UPSC, NEET, AIMS, JIPMA. This one is AIMS 2014 question. Come on, people. Excellent. Many people have given the answer. Let us not give much of importance to this question. The right answer is Antony von Leeuwenhoek, and who is called as the father of virology by some people because of this particular microscope only, he was able to start understanding viruses using electron microscopy activity. But though it is not rightfully deserving, you know, Leeuwenhoek was the fellow who was actually inventing microscope. What did Ross do? What did Ross do? Ronald Ross was the fellow who worked on malaria. Okay, what is Laver then? Who is Laver? If you say Ronald Ross is for malaria, then who is Laver? Laver is the fellow who worked on Plasmodium vivax. But this fellow worked on Plasmodium falciparum and malariae. So Laver was even before Ross, but Ross was able to make everything organized and he spoke about the life cycle. That is why Ross became more famous than that of Laver. Louis Pasteur is the one who gave you the germ theory. Next question. Who is the father of modern microbiology? Among the given options. Many times these questions make you fall in the exams. I do not want you to have such mistakes in the exams. That's why simple questions have been added. Though they are one-word questions, you can see the confusion happening in many people. Definitely it can't be Edward Jenner and Franco Storius. So the option should be between B and C only. But those people who chose C, you have to understand, Lister gave you the Lister's hand washing technique. That's all. Apart from that, he was not important in becoming the father of modern microbiology. But who is the father of modern bacteriology? Who is the father of? Excellent. Yes, good question. Be happy. These are appearing to be boring. Okay, do you think, be happy, this is a boring question? For example, if you are doing something very important in your life, after 40 years of people forget you, will you be happy with that? That is the only reason why historical questions are never missed. Remember, every exam will have at least one question which is based on history. So when you forget this, you are actually kneeling your own, you're just hammering your own foot. So please be careful. Please revise as many times as possible. Right answer is Louis Pasteur. Lister is not the answer. Which of the following organism contains both DNA and RNA? Yes, as expected, 50% of class made this mistake. Now 60% people have made the mistake. This is supposed to be a dead easy question. It was a very good question. Be happy. Please remember, these kind of older questions will start repeating. And this question was first, I'm just talking to Be Happy. This question was first asked in 1974 exam. Then it was asked in 1985. Now this question appeared in 2007 and then came in 2015. When they repeat, you're not supposed to say that you do not know. Bacteria is the only organism who contains both DNA and RNA. Plasmids are only known to contain DNA. These are called as extra chromosomal DNA. Prions don't even contain DNA. They're infectious particles. So please understand, they are just infectious particles. Virions are altered structures of viruses. Next, metachromatic granules are stained by Yes. So many people know the answer to this question. You have done a very good job. Now there are other stains also you have to know. Ponders stain, Albert stain, Neisser's stain. Excellent. All these stains are pointing towards which organism, people? All these are pointing towards which organism? 35% people have made a mistake in this question. So don't make the same mistakes in your exam, people. See, metachromatic granules mean, let me tell you faster. Metachromatic granules means, for example, this is a granule. And if I throw color of a particular color, if I throw light of a particular color, for example, I throw purple color, if it gives back only yellow color, that is called as fluorescence. One color is hit, a different color is coming out, it is called as fluorescence. But when I hit with one color, it gives multiple different colors. That is called as metachromaticity. And that metachromaticity is found in certain organisms like Corynebacterium diphtheriae. It can be found in Mycobacterium tuberculosis. It is found in Gardnerella vaginalis. It is also found in Spirillum volutens. Please understand, the first discovered organism for this metachromatic granules was Spirillum volutens. That is why it is also called as volutin granules. These granules were first discovered in Spirillum volutens. That's why they're called as volutin granules. Next question. Peritrachate flagella are seen in. This is a new question, 2017 question. We'll see how many of you can give me the right answer here. There is a possibility of many people making a mistake. Simple question, but many people will make mistakes. Yes, as I thought, there are many people who made mistakes. Look at this. If there is a single flagella, it's called as polar flagellum. And this polar flagellum is a property of Vibrio cholerae and Campylobacter. Proteus is motile. It is capable of causing swarming motility. Why? Because the flagella is present on all the directions. Who else can have peritrachate flagella? E. coli has peritrachate flagella. Salmonella typhi also has peritrachate flagella. What about Legionella? Legionella may be flagellated, may not be flagellated. Sometimes it can be peritrachate or it can be lophotrachate. So let's go for the next question. Which of the following is not capsulated? Radhika Chandra, the father of modern bacteriology is Robert Koch. Okay, let's go for this question. Sorry, let's go for this question. Yes, which of the following is not capsulated? Nice, you all are very good, very good, very good. 0% people have chosen Cryptococcus, and I'm really proud of you. Cryptococcus is a fungus, and it is definitely capsulated. So shall I tell you one important fact about every single organism which is capsulated? Shall I tell you one extra fact about every single organism? Only if you want. Hello? Okay, let me tell you this. Pneumococcus is the most common cause of adult meningitis. It is the most common cause of lobar pneumonia. Cryptococcus is the most common cause of meningitis in HIV AIDS patients. Meningococcus is the most common cause of adolescent meningitis. Pseudomonas is the most common cause of meningitis in burns infection in the neck area. And it is also the most common cause of abscess in the lung area if it is AIDS patient. But Proteus is the only organism who doesn't have a capsule. Next question. Following grows in cell-free medium. Which one is it? I have twisted the question so that you'll be able to answer it better. Come on, people. This was a Jipmer question which I have twisted. Welcome Raj Zenith and Chandni. Yes, this question will look very simple, but you have to just understand before you click the answer. That will be the only thing expected. The drug of choice for Cryptococcus is right now fluconazole. You're not supposed to use amphotericin B because amphotericin B by itself can be nephrotoxic, and during nephrotoxic condition, you'll be having loss of globulins, so you'll not be in loss of immunity, because of which you'll not be able to fight the infection better. Is it okay? Be happy. Okay. Now, how can I understand the question? Look at it. You are like to look at the difference between intracellular organisms and extracellular organisms. Rickettsia, M. leprae, Treponema, all of them are intracellular organisms. And if they are intracellular organisms, you can grow them only in cell line cultures. But Bartonella does not need a cell line. Cell free means what? Medium which is outside the cell line cultures. So without cell line cultures, Bartonella can be grown because it is extracellular organism. I hope you'll be able to answer this better next time. Next question. Involutional form are seen in which phase of bacterial growth? I'll tell you 1 point in favor of each of the phase so that you'll be able to use it in your exams. Well played, people. Very well played. Thank you so much. You're playing very well. So tomorrow, are you okay for the class? At 10 p.m.? I understand, be happy. Correct. 10 p.m. tomorrow, are you okay for the class? See, only if you are saying that you're going to come, I'll schedule it. Otherwise, I'll take a break. Okay, this is the leaderboard here. Okay, so lag phase is the phase where the microbe is reaching maximum size. Log phase is the phase where the microbe has minimum size, maximum number, and please note, in the log phase only, perfect complete staining of the organism happens. Complete staining of the organism happens. Stationary phase is the phase where spore formation happens. Involutional forms means the organism is appearing abnormal. Abnormal form of an organism can be seen in the death phase. Some organisms die, but they not be losing their cell wall, cell membrane completely. So improper loss of cell membrane, cell activity will be called as your involutional phase. Next question. True regarding lag phases. Time taken to adapt in the new environment, growth occurs exponentially. Plateau in lag phase is due to cell death. It is the second phase in the bacterial growth curve. Which of the following is a true statement? Mixed bag, Sayesh. The topic is mixed bag. previous questions, previous exam questions from microbiology. Is that okay, Sayesh? Sayesh is asking, what is the topics for tomorrow? For tomorrow, we'll have mixed bag of questions. From bacteriology till virology and parasitology, we'll have questions from all the chapters in one hour. Okay. Okay, excellent. Only 68% people have given the answer. Now look at this. Lag phase means what? In a medium, you have kept only one single bacteria. That bacteria tries to understand the environment, will try to take up the nutrition from the environment and goes into the synthetic phase. It means S phase, where it produces maximum number of DNA. And when it assimilates as much amount of nutrition and produces as much amount of DNA as possible, what is happening to its size, people? What is happening to its size? Maximum size. Culture medium used for Entamoeba histolytica is which one? Culture medium used for Entamoeba histolytica is which one? This may look like a single one-line question, but it is extremely difficult to choose it. If you have not heard this, you'll never be able to answer. If you know it, you'll be able to answer. These kind of questions are also equally dangerous questions, so please be careful with these questions. Okay, unfortunately, only 20% people have given the right answer. It means only 1/5 of the people have given the right answer. Oh, welcome, aspirant. This is the leaderboard. Raj, Varshini, Raj. There are two Rajes here. Raj, Varshini, Granger, Raj, Kaneki, Twinkle, Debayan, Proud Indian, Radhika Chandra, Sheldon, and Sharif Ahmed. Sharif Ahmed, are you new to this class? Have you come to the class for the first time? The right answer is Phillips medium. Let me tell you this. What are the different kinds of cultivation media that you'll use in case of E. histolytica? Oh, you come before? So sorry. Okay. Boyk-Droblov's medium. This is a Russian fellow. Boyk-Droblov's medium. This Boyk is the other fellow who actually described about sarcoidosis in pathology also. Sarcoidosis, Boyk-Droblov's E. histolytica medium, Phillips medium, Schaffer-Fry, Jones, Balamut's, and Diamond. Do you know what is Balamut's contribution to the field of parasitology? Balamut is actually used for a name called as Balamuttaya. What do you know about Balamuttaya mandrilis organism? What does it cause? What does it cause? What does it cause? It causes meningoencephalitis, which is called as excellent. It is called as amoeba or amoebic meningoencephalitis. Primary amoebic meningoencephalitis is caused by Naegleria fowleri. Granulomatous meningoencephalitis is caused by Acanthamoeba organism. This one is causing amoebic meningoencephalitis. Which of the following amoeba does not have neuropathogenic effect? Which of the following amoebae does not have neuropathogenic effect? Excellent, all of you. So just now I told you, Naegleria, Acanthamoeba, Balamuttaya, all are capable of causing meningoencephalitis. Diantamoeba, you have to ask which kind of organism it is. Diantamoeba fragilis, Diantamoeba coli. These are not supposed to cause much of a disease. They are known to be seen as a commensal in the GIT. They don't cause neuropathogenic effect. If at all they cause defect, they will be causing diarrhea only, not even dysentery. Okay, let's go for the next question. Okay. We'll do faster. All the following statements about L-tor vibrios are true except which one is the false statement? Go for it. Zishan Pathan, Raj and Radhika Chandra have given the fastest answers, followed by Dr. Sheldon and Sayash. Very well played, people. But only 35% people have given the right answer. Frinchu. There is a new person, Frinchu. Frinchu, are you new to the class? Frinchu? Okay. Are you able to follow the class, Frinchu? Are you comfortable with the class, Frinchu? Is the speed okay for you? Are you an FMG aspirant, Frinchu? Are you FMG aspirant? Okay. Remember, L-tor vibrio cholerae. Both, anything that you say, yes. Vibrio cholerae, or that is L-tor or classical, they are always known to attack only GI epithelial cells. The only thing they can cause is localized manifestation called as very severe diarrhea. They are not even known for causing dysentery. So attacking any cells other than epithelial cells is absolutely wrong, and humans are the only reservoir. That is why there is no carrier state or subclinical cases of this condition. They can survive in ice water, and they can easily die in case of 30 degrees Celsius. That is for boiling. So they are heat labile and acid labile. Next question. 7-sheath flagella is seen in which organism? 7-sheathed flagella is seen in which organism? Sakti Manaswai Siddhuraju, Radhika Chandra, Zishan have given the fastest answer, followed by Fatima Mustafa and Be Happy. Well played, people. 7-sheath flagella is seen in. Here, only 25% people are given the answer. It means only 1 out of 4 people are correct. No problem. Okay. Welcome, Kanishka S. The right answer is H. pylori. Remember, Vibrio cholerae is monoflagellated. Spirochete will have endoflagella. That is, the flagella will never be seen outside. The only organism who is looking like intermediate between that of a spirochete and a spirillum will be H. pylori. What is H. pylori? It's a helical organism, and it will be having 7 sheets of flagella. Every flagella will have 7 sheath of covering around them. That is the beauty of Helicobacter pylori, and it is not a simple organism. It is not a curved organism. It is not a spirochetal organism. It's intermediate between curved. Curved is Vibrio cholerae. Spirochetal is spirochetes. Intermediate between them is called as H. pylori. This is actually a particular helical organism. Helicobacter pylori has an elder sister. The elder sister of Helicobacter pylori is Campylobacter jejuni. That organism is just like Vibrio cholerae because it is only curved. Next question. Halophilic vibrio, which causes wound infection on sea coast, is which organism? Halophilic vibrio that causes wound infection at sea coast is which one? Okay, 55% people are given the right answer. That's a very well played game. Very good people. Surendra, Radhakishandra, and Dr. Sheldon have given the fastest answer, followed by Vikram Chandran, Sayesh. Well played. Yes. So, what is halophilic? Please understand there are many people who will use different kind of meaning for halophilic. Halo means salt, understood. Philic means loving, understood. But what is the extent of the love? That is the question. See, if I say Vibrio cholerae as an organism, is it halophilic or not? Tell me. Tell me, people. Vibrio cholerae is halophilic, yes or no? Okay, this is the leaderboard. Tell me whether it is halophilic or not. Please understand, Vibrio cholerae can survive in saltwater conditions, but it is not halophilic. Halophilic means dependent on salt. If, for example, I call Vibrio cholerae as halophilic, it is not halophilic. If I call it as halophilic, it has to depend on NaCl. But if it is non-halophilic, then in the absence of NaCl, it can survive. But when I give NaCl, it survives better. Stimulation of growth of organism in the presence of NaCl is called as non-halophilic. But Vibrio vulnificus will survive only in the presence of NaCl. NaCl, if it is present, it lives. If it is absent, it dies. Do you understand the difference here, people? Okay, next question. Simple question. Begel is caused by Raj, Varshini, Popcorn have given the fastest answer, followed by Priyanka Sharma and Sheldon. Begel is caused by, only 33% people have given the right answer. Raj is asking, what is Begel? I'll tell you at the end of this question. When I say the answer, everybody will be able to answer it because the name is so simple. So remember, in the family of Treponema, we can divide the disease caused by them into 2 major classes. One is sexually transmitted disease. The other is non-sexually transmitted disease. There is only one organism which is STD, which is Treponema pallidum, that causes syphilis. All the other diseases are called as non-sexually transmitted disease. Among them, you have Treponema pertinii, which causes yaws. Calatium, which causes pinta. These are called as epidemic and endemic trypanomatosis. More than the word epidemic, endemic is better. This is called as endemic trypanomatosis, which causes skin lesions in the axillary area or the sweat prone area. Endemicum is known for causing endemic syphilis. Endemic syphilis. And that endemic syphilis is looking like syphilis, but not completely sexually transmitted. And endemicum causes endemic syphilis. That is called as Bejel in the local country. Is that okay? So, no, they are not eliminated. They are still present. Okay, next question. 24-year-old farmer presented the history of high-grade fever for 7 days and altered sensorium for 2 days. On examination, he was comatose and had conjunctival hemorrhage. Urgent investigation showed a hemoglobin of 11 gram per deciliter, serum bilirubin of 8 milligrams per deciliter, and urea of 78 milligrams per deciliter. Peripheral blood smear was negative for malarial parasite. What is the most likely diagnosis? Okay, so simple one-liner, many people made mistakes, but a long question, many people are getting it right. What does it tell you? The longer the question, the more the data offered by the question for you to analyze. The chances of you becoming right is also higher. So always pray for a lengthy question than that of a very short question, because if there's a short question, it is easy. It is easy for everyone. If you make a mistake, it costs you very much. If it's a long question, many people will be able to make mistakes so that you will also be able to come out of it. How to get one-liners right? That's a very good question, Yatina. It's a very innocent question. I pray that you get all of them correct, but please work on as many questions as possible. See, when you're going towards the exams, the INICET exams are coming up. So try to attend as many MCQ sessions as possible. Try to give up as many MCQs as possible. Only then you'll be able to do it. There is no other shortcut for it, okay? Wheals disease is the right answer. Can you tell me what are the pointers in favor of Wheals disease? What are the pointers in favor of Wheals disease? Wheals disease is leptospirosis caused by Leptospira icterohemorrhagica. How do you call it as hemorrhagic jaundice? Because you can see conjunctival suffusion, you understand bleeding is happening. And what is the proof for bleeding happening? The hemoglobin has come down. Who is he? A farmer. Farmers are generally not supposed to be anemic people. Farmers may look thin, but they are not anemic unless they have hookworm infestation. Because the food taken by farmers can be green leafy vegetables, there's enough to keep them non-anemic. And he's 25 years old. So hemoglobin of 11 gram percentage is a matter of concern. Bilirubin 8 milligram tells you that there is jaundice. So hemorrhage plus jaundice can tell you it is hepatorenal syndrome because you are facing pre-renal failure. That is 17 milligrams per deciliter. They have not mentioned about creatinine. If they had mentioned about creatinine, it would be renal. But because only urea is elevated, it is a pre-renal condition. This is Wheals disease, leptospirosis. Next question. A sewage worker presents to emergency department with fever and jaundice. Lab findings reveal an elevated abundant serum creatinine suggestive of renal failure. Which of the following antibiotics is recommended? Which of the following antibiotics is recommended? Okay, only 40% people are given the right answer. It means they're still in a dilemma to choose the. See, first you have to make a diagnosis. Second, you have to think what can be the best drug of choice. But if that drug of choice in your mind is not there, then which is the next best drug? That is how your thought process has to go. It has to happen within 30 seconds. That is the cruelty of such kind of situations. But please remember 1 minute, people. Just remember one thing. In your exams, you don't have to answer faster than 30 seconds. You'll definitely have 45 to 1 minute time. But why are you coming here? You're keeping on being yourself on toes. You all are taking the suffering so deeply that when you go to the real exam, you will be better than many people who never came to the classes. There will always be a difference. Please understand, hard work never fails. I take a class. Sometimes students will come in huge numbers. Sometimes they don't come. But still, I motivate myself to come and take the class again so that I'll be able to reach out to many people. My ultimate goal is to reach more people, to be known by more people, because I have been teaching from the past 2010. But because in the last 2 years I was not in the internet season, I was not known for many people. So I want to make myself known. I'm teaching a lot. At the same time, I would like to be happy when you become a successful student and I come back and tell me that I'm a successful. So my hard work is to make sure I keep on doing my work no matter what happens. You keep on doing what you can do. At some point of time, you'll be rewarded. Please remember, whatever you get with hard work is always hard earned. Hard earned thing sticks to you more strongly than anything else. Nobody can take that away from you. When you have been sitting in such kind of MCQ sessions so many days and so many times and so many minutes, it will definitely make a difference in the way other people are writing the answer and you are writing the answer. So never feel tired of coming to any MCQ session. Any MCQ session, beat a wrong answer, even if you're at the bottom of the rank, do not worry, because you're definitely better than the person who never came to the class. Is it not? So look at this part here. A sewage worker means you're focusing on rats. And fever and jaundice with serum creatinine means the hepatorenal syndrome has moved towards the renal condition. Now it is not pre-renal anymore. It is complete renal attack. So in that Weil's disease, the drug of choice can be IV penicillin. If it is not systemic, then what is the drug of choice then? Thank you, Fatima. Tell me, if it is not systemic Weil's disease, if it's just mere simple leptospirosis, what is the drug of choice? If the leptospirosis is not attacking your brain, the drug of choice would be doxycycline. Excellent, Raj Bharat. The right answer is doxycycline. None of them. Okay. Growth of C. diphtheriae in tellurite agar occurs when? Growth of Corynebacterium diphtheriae in tellurite agar occurs in. Okay. So now I'm understanding something as a trend. You made the same mistake yesterday. I told you for C. diphtheriae, we have two types of media. One is Loeffler's serum slow. The other is potassium blood tellurite or cysteine blood tellurite. I told you only yesterday that if you want rapid answers, go for Loeffler's serum slope, which can give you answers within 6 hours. So for Loeffler's serum slope, the best answer is B. But tellurite agar is the most selective medium. Yesterday also somebody asked me whether Loeffler's is selective or not. Loeffler's is not highly selective. It's a moderately selective medium, while your potassium tellurite agar is the most selective medium, and that will take 48 hours for you to get the answer, which is 1 to 2 days. So don't make the mistake in the exam hall. Please understand, for rapid investigation, go for 48 hours of Loeffler's serum slope. For confirmation, go for 48 hours. That is potassium blood tellurite agar. Last question for, okay, 2 more questions for the day. Opacity around the colonies of Clostridium perfringens is due to which toxin? Opacity around the colonies of Clostridium perfringens is due to which toxin? Okay, that can be accepted, Raj. Okay, so 50% people have given the right answer. That's a very good way of answering it. Remember, alpha toxin is also called as lecithinase. It is also called as Naegler's reaction toxin. What is Naegler's reaction? Formation of opacities around the colonies is called as Naegler's reaction. Let me show you a picture. Look at this. This is how you perform Naegler's test. Let me zoom into it for you. Here on the top area, you'll see lines of Clostridia inoculated. On this side, I have added anti-alpha toxin on one half of the plate. On this side, there is no anti-alpha toxin. It means on this side, alpha toxin is free. That alpha toxin has one enzymatic activity called as lecithinase. Lecithinase is a phospholipase. That phospholipase will break the phospholipids present in the local area and accumulate fats in the local area. That fat accumulation causing opacity around the colonies. Did you understand this, people? Did you really understand this, people? We create a particular plate. In the plate, we divide them into two halves. On one half, I add anti-alpha toxin. On the other half, no anti-alpha toxin. Here, alpha toxin is free. Here, there is no alpha toxin. Now, when there is no alpha toxin, straight lines are straight. But when there is alpha toxin and there is no blockage of alpha toxin, the alpha toxin will show its activity. What is activity? It breaks phospholipids and liberates glycerides. It gives you triglycerides and the lipids. That lipids will come and form opacities. This is called as positive Naegler's reaction, and that is shown by alpha toxin called as lecithinase. Did you understand this? Yes or no? Please let me know. Yes. Okay. Next question. You can read the theory part later. Last question. Which of the following species of Clostridium does not break carbohydrate and protein? This is definitely an expected question for this year. This year they will ask you the question. Please be prepared for it. Septicum, novi, Clostridium, perfringens, tetani, botulinum, all these organisms can be divided into two types. Either they are proteolytic or they are saccharolytic, or they are predominantly proteolytic or they're predominantly saccharolytic. But one organism among the given four is neither proteolytic nor saccharolytic. Which organism it is? Look at the leaderboard here. Raj is on top, Radhika Chandra second, Varshini third, Raj fourth, Devian fifth, Surendra sixth, Sheldon seventh, Popcorn eighth, Balamurugan ninth, and Kaneke 10th. Welcome, Adishekar. So the right answer is cochlearum. This question can come out in tomorrow's session, in the coming exam. So do not make this mistake. Cochlearum is neither proteolytic nor saccharolytic, neither predominantly proteolytic nor predominantly saccharolytic. So with this, we'll wind up today's class. Tomorrow at 10 p.m., will you come for the class? I'm just wanting to know this. Will you come for, yes. Tomorrow, will you come for this session? Shall I schedule it? Only if you say yes, we'll do it. Yes, microbiology. Cochlearum is known for being in the part of cochlea, and whenever there is actually when there is a capability, it is capable of causing ear infections. Apart from that, it is capable of causing abdominal abscess. It is capable of causing anaerobic septic focus. Okay, so you can follow me on Telegram for the free links, and this is the Instagram where you can follow me. So all the people who have been very patient listening to the class, tomorrow microbiology, 50 questions, MCQs, 10 p.m. to 11 p.m. Sir, put questions on. Did you not see Proud Indian? I put questions on parasitology, amoeba, balamutaya, all these things. If you want, I'll add more. I'll definitely do it tomorrow also. Is that okay, Proud Indian? Thank you so much for being very patient. Have a good. Okay, I'll do it. Thank you very much. Have a good night. Please put a thumbs up if you like the class. Okay, good night, people. Thank you, Christina. Thank you, all of you. Thank you very much.